There's also a need to make sure inside, more than just the outside perimeter, inside you have a level of security as well. Because exactly, yes. Because you don't want the wrong people unknowingly going into patient halls or and also then spreading the virus from there. Yeah. So again, that's the point of this whole task force, is to help identify those needs and then communicate them upwards. So yeah, I very much appreciate that offer. Yeah. Here. So it's not necessarily like we're going to build anything, but just more dedicated space for this. Okay. And that's so in addition to this support of helping stand this facility up, CRS is contributing with the, you can see here, this place is not ready as it is. So CRS is helping, my organization is helping with putting plastic vinyl carpeting down, because this cannot be cleaned. You can't clean the virus off of this kind of wood. But if you put the carpeting down, you can clean that area and then keep it sanitized. It has clinical care in it, emergency medical services, social behavioral change. So it's very important to keep in mind the neighboring communities and the outside public's opinion of this facility. If people know this is a bad facility, they're not going to want to come here. And so keeping that mentality up is very, very key. As well as protection and then some security as well. All are on that task force to make sure we have all the necessary inputs to make this a success. Yeah. Please.
So you already have the facility. When are you ready to admit patient number 1?
Yeah, that's a good question. So I can only speak for what CRS can contribute. So right now we've already had our contractors come in. They should be starting work as early as next week. That means that they're going to be putting down the carpeting, repairing the wiring, repairing the electrical, making sure that everything is straightforward from a structural perspective. But this task force really is the ones in charge of making sure the facility and all of the policies and procedures and all of the different clinical care components are in place before you actually bring a case here. So that part, I would say, is Chirudu Hospital needs to also answer that question. I would say we could probably have it running in 2 to 3 weeks. But again, I'm not the only one in that. We're working on behalf of the ministry. They're the ones ultimately who have to make that decision. And so I would say that it's better to be prudent. I know that this facility. So we talked about 2 halls. That's just a phase 1. Phase 1 would be 160. Phase 2 would be as many as 500. And then with the appropriate resources, and I really mean resources, because you're talking about needing to use that outside area, the track there, as well as level 2. There's a whole level 2 that's covered. Again, this is a really good resource for Uganda because you've got a structure in place that can withstand the elements, the wind and the rain. All you would need is basic tents put up on that area. If you did that, you could increase the number here. We estimate to 3,000. You could have 3,000 patients in here.
For Namboole.
For Namboole, with the right resources. Because that is very, right now it is not equipped to do that. But if you were to provide the tents, if you were to provide the other needs, that's something that could be built out. This hall as well for that purpose. So, a lot of this is trying to get started and then figuring out what is needed along the way. And so I think sometimes we'll find large families that will need to, and maybe this area isn't ideal for them. Maybe one of the extra rooms that we see might be ideal for them. But if you're talking about a family of 4 or 5, I think the average household size in Uganda is 5. That might suffice for that purpose. But the idea is to have at least a space available so that way we don't have to separate any more than necessary. Right. My name is Brendan Stack. I work for Catholic Relief Services here in Uganda. I'm a program manager and the emergency coordinator for the COVID response. We are supporting the Ugandan government and the Ministry of Health in standing up Namboole Stadium as a non-traditional isolation facility. Thank you.
My name is Brigadier Dr. James Chiengo, a member of the Joint Task Force, and our objective for coming here is to assess the capability built up by Brandon and his team of the Catholic Relief Services in making sure that we can contain the infected cases that are not symptomatic. The Agency Task Force is going to ensure that forces are around to keep it safe and secure, to stop people from mixing with the community, from mixing with the medical staff, and so that the infection is contained within. That's why we come here, to try to see that what we are going to enforce is possible. People can come here, stay, they enjoy the environment inside here, and they are not in touch with the community outside to increase on the transmission. So here we are going to have the milder form of disease only isolated from the community, who will be okay, all right, but we don't want them to infect others who may be vulnerable. Like the old. And then the community is isolated, and it's such a good place because it's isolated from the community. That's why we come here, to try to see that what we are going to enforce is possible. We have found that the space here can accommodate 200 patients, the first phase. However, the space can go on up to 3,000. We are grateful for the work you're doing, putting this together, and we hope to support you